Welcome to Caregiver SOS On Air, presented by the WellMed Charitable Foundation, with nationally known gerontologist Carol Zernail and award-winning veteran broadcaster Ron Aaron. This program provides health, wellness, and other information for caregivers who are vital to the health and well-being of so many people across our country. And now, here are your hosts, Ron Aaron and Carol Zernail.
Well, thank you so much for joining us today on the award-winning Caregiver SOS On Air. I'm Ron Aaron. Our podcast available wherever you get your podcast, and we're also on the radio in several markets in Texas and Florida as well. We're going to be talking about a neat program called Pair to Care, talking about all kinds of support for caregivers for people living with dementia. Our co-host today, filling in for Carol Zernail, is Tina Smith. Tina is the Senior Director of Caregiver Program Operations with the WellMed Charitable Foundation. She's got a bachelor's degree in psychology, a master's degree in social gerontology, and Tina's been providing support to family caregivers for over 30 years. She began her career working in the long-term care industry, moved on to serving at the Bay Area Agency on Aging, and there is an agency on aging in almost every county in America. Tina also taught gerontology courses at Kaplan University. And Tina, it is great to have you with us again.
Oh, thank you, Ron. I always enjoy being here and talking to the guests and learning about new things. So I'm looking forward to
find out about a really neat program. We touched on it when Karen Moss was with us several months ago. Karen is a registered nurse of 25 years, a nurse scientist who is a tenured associate professor of nursing in the College of Nursing at The Ohio State University. Go Bucks! She's a distinguished fellow in the National Academy of Practice Nursing Academy and a fellow of the Gerontological Society of America. Dr. Moss's work is focused on improving advanced care planning, healthcare decision-making, and pain outcomes through palliative and end-of-life care for older adults living with dementia. And she also, through her program called Pair to Care, has done incredible work with older adults and families living with dementia. And Dr. Moss, it is great to have you back.
Thank you so much. It's great to be back.
Well, when we last talked, you had touched on your Pair to Care program and a study that you were in the midst of. Bring us up to date.
Well, I am super excited to share that Pair to Care, our initial testing, what we call in the research space, our feasibility testing, is completed. And we had phenomenal results. And we know now, and we can say with certainty, that Pair to Care is an evidence-based program because of the evidence that we have started to collect around feasibility and acceptability, which just means that people came to the program when we asked them to, and they stayed. So no one left our program voluntarily. So I'll just remind our viewers what Pair to Care is. So Pair to Care is a peer support program it's a 6-month virtual program that was developed with Black family caregivers of people living with dementia. It is flexible by design. Folks can connect in ways that's meaningful to them and on a flexible cadence. It is designed to be non-judgmental. Our former caregivers, meaning they are no longer caregiving for someone, their care recipient that they cared for in the past has passed away. They serve as mentors to individuals who are currently caregiving for someone living with dementia. 6 months.
That's very valuable.
Yeah. As we saw, we heard from participants, you're exactly right. The way these mentees were able to connect with their mentors. And a surprising, spin on this is that, we went in from the research perspective, focused on the caregiver, right? Focused on the mentees, but also learned along the way how much the mentors, the helpers, right? So the helper theory kicked in, how much they benefited from being mentors.
So I'm curious just to learn a little bit more. So what does that look like, that 6-month program what happens? How do you get the two together, the former caregiver and the current caregiver? Just what does that look like?
Great question. So when individuals indicate that they are interested in being in the program, we screen them to make sure they are at least 18 years old, they were a current or former caregiver. We ask that our former caregivers be at least 6 months removed from death because we want a little bit of time, right? Not that grief has a timestamp on it, but we want some time to be within that, since they lost their loved one. And we also conduct assessments to make sure folks are ready to serve as a mentor, that they're comfortable talking about death and dying, because we know that that conversation can come up, as we saw. And we identify our mentees, our current caregivers, in a similar way. They have to be caring for somebody living with dementia, and we gather a lot of information. We gather some qualitatively through talking to these mentors and mentees, or potential mentor and mentees, and then we also have a survey that we have them complete about things like their hobbies. We know the type of caregiving relationship they're currently in or were in the past. And so we use all these data, we pull them together. So we have like a qualitative piece and a quantitative piece, and we bring those together to figure out who would be best to pair with whom. Once we do that, we make sure that our mentors are trained. We train them more on what peer to care isn't than is not, because there's a lot of flexibility in what mentors and mentees are able to do during that time together. We make sure they're clear on how they should connect. It's a virtual connection, so no in-person connection for these, and that's so we can pair people across the country and in the future across the world, right?
And
And
stay with us just a minute. I want to let folks know who may have just joined us.
yeah.
You're listening to the award-winning Caregiver SOS on air. I'm Ron Aaron. You're hearing Dr. Karen Moss. Dr. Moss is at the Ohio State University. She's a registered nurse, and for 25 plus years, she's also a nurse scientist. We're talking about her incredible program called Pair to Care. Tina Smith, our co-host today, filling in for Carol Zernail. And Dr. Moss, you mentioned that you're pairing former caregivers with caregivers. How do you find the caregivers to get into your program?
Well, the reality is caregivers are everywhere. They're on PTAs, they're in your workplaces, they are everywhere. So we go out and we hit the pavement and we talk to folks in their natural environments. So whether it's at a table event at a health fair that is on a Saturday morning, and folks are coming through and they're getting literature on caregiving or some sort of health topic, we talk to folks there. We connect with community-based organizations who have access to caregivers as well. So it's a multi-pronged approach that we use to be able to reach our caregivers in the community.
And the focus remains caring for folks with dementia.
That's correct.
Well, you sure picked a tough one.
It is. It is. Hence the need, right? Hence the need. And that's what we ended up seeing in our initial testing of peer to care. It's probably the reason why none of our participants left voluntarily. None of them left. For 6 months, they stuck it out, right? And so I think it speaks to, the need for support for individuals who are caregiving. We also, even though within this program, because this was the initial testing, it was a smaller study, we saw movement on one of our quality of life subscales that can be kind of an early indicator of peer to care potentially being able to help with quality of life improvements in the future. We won't know that until we conduct a larger study, right? And so that's why we have a funding application under review at the National Institute on Aging currently to acquire additional funding to continue to test peer to care. But we saw an increase. Caregivers told us that they had reported more family interaction while in the program. They also reported feelings of less demands of caregiving, and also less worry. which, for a study of this size to be able to see movement on those ends, that's huge. That's huge.
We'll talk a little bit about, because folks listening may say, hey, dementia is dementia. It doesn't matter if you're black or white, orange or green. What are the challenges in the Black community where it comes to folks with dementia?
Yeah. So the Black community, unfortunately, and this is in the literature, is twice more likely to develop dementia. And as bad as dementia is, then that means family caregivers of these individuals who are Black are then also at risk, high risk, the highest risk for the negative impacts of caregiving. And so, yes, all of our communities, all of our racial and ethnic groups could benefit from a program like Peer to Care. But we thought it best, because of what the literature shows, to start in this community. And our plan has always been, even before we had these wonderful results, to be able to expand Peer to Care to other racial and ethnic groups. And we are actually starting to be able to do just that. So, yeah.
And one of the things I know you look at is the stress in dealing with pain and the challenges that both caregivers and their care recipients feel. How do you address the pain issue?
Yeah, pain is another tough one. You layer on that on top of dementia, and one of the challenges is the assessment of it, especially when as the dementia progresses. And so part of what we realize is it's often good to have a sense of what pain is like for that individual pre-dementia, right? So that this is why our caregivers are so important to the care that we give as healthcare providers, because if we know what the pain was like before, we can, those chronic pain, we can help to get ahead of some of those for these individuals living with dementia, who are sometimes no longer able to verbally express their pain. And then when it comes to acute pain, our caregivers are super vigilant and ever vigilant. But one of the challenges with dementia is that those behaviors that we often view as dementia type behaviors are often mistaken for just that. And we don't address the pain, right? So that folks can continue to suffer in pain.
All right, we're going to come right back to you. That's a good point. I want to pick up on that in just a moment. You're listening to Caregiver SOS On Air, our award-winning podcast available wherever you get your podcast. We're talking with Dr. Karen Moss. She's at The Ohio State University in nursing and running an incredible program called Peer to Care. Tina Smith, our co-host. You're listening to Caregiver SOS On Air. Well, thank you so much for listening to Caregiver SOS On Air. We're delighted to have you with us. We come to you every week with a discussion of an issue, a problem, some accomplishments involved in caregiving with more than 60 million caregivers across this country, but most thinking they are the Lone Rangers. We try to bring you the latest information and help that can make that job easier and more manageable. Caregiver SOS On Air takes a look at trends across this country. We provide tips on how to be a better caregiver, and most importantly, where you can go for help. On Caregiver SOS On Air, we try to give you what you need to make that caregiving manageable and to provide you with the help that can make your life easier. I'm Ron Aaron. Carol Zernail and I are delighted to co-host this program, and we're thrilled you've joined us on the award-winning Caregiver SOS On Air podcasts available everywhere, brought to you by WellMed Charitable Foundation.
Hello, friend. Hello, friend. Really good to see you once again. Hello, friend. Hello, friend. Really good to see you once again.
We are so pleased you're sticking with us right here on the award-winning Caregiver SOS On Air. I'm Ron Aaron. Our podcast available wherever you get your podcast. We also are on the radio in several cities in Texas and Florida as well. Our special guest, Dr. Karen Moss, and Dr. Moss is a specialist not only in nursing, but in nursing science and dealing with a program called Peer to Care. Tina Smith, our co-host, is with us. And we were talking a moment ago, Dr. Moss, about pain, and someone with dementia may not be able to articulate, hey, I've got a tooth that's really hurting, Or, my back is killing me. It comes out in other ways. Like what? What are those behaviors that might indicate pain?
hmm So facial grimacing, um, tenderness to touch, that the focus in on a particular area. So maybe it's the knee, maybe it's the rubbing of the knee, right? Maybe it's their gait, the way they walk. Maybe it's particularly normal or particularly one way or the other, but it changes. So they're walking kind of, off kilter because of the pain. So these are some of the things we tend to look at, and we're able to use different types of instruments or surveys, right? Even through observation to be able to measure the nonverbal signs of pain. So,
You have to
so
be a detective.
kind of a detective, yes. And again, I'll say this again because it's so important. The caregiver's perspective, and I'm talking about whether or not this individual is out in the community, whether they are in an assisted living or nursing home, and they're working closely with healthcare providers. The perspectives of those caregivers who are coming to visit or who live with them is crucial for us to be able to, because they can tell when these changes start to happen that we, as healthcare providers who may not know them as well, are likely to miss.
So is some of this, I guess, the training that you're talking about, the educating of the caregivers, is that part of the Pair to Care program, or is that another program that you have at the university? Is it kind of commingled all together because it's so important?
Yeah, so peer to care is not specifically focused on pain, but pain is one of the things that these mentors and mentees can talk about because we do want just that to happen. As part of the training, what we offer, and we share this with our mentees as well, but for our mentor training, we provide them with a list of things, that a whole host of things that they could potentially talk about. We never say you have to talk about XYZ, but there's topics focused on the caregiver, there's topics focused on the care recipient, meaning the person living with dementia, and there's topics focused on caregiving or all of the above. And in actuality, if they want to talk about the weather, they can talk about the weather. So we don't make it so prescriptive. But pain is on that list because it's so important. It is considered the sixth vital sign. It's extremely important that our mentees are able to share strategies that they use, right, when they cared for their loved one that help um, to impart that on the individual who's currently caregiving.
One issue that we've talked about over the years on Caregiver SOS on air is the question of dental care. Very often with someone with dementia, dental care sort of slips away, and yet it is so vital to the overall wellness of the patient.
Yeah, and I would say you're absolutely right. It's even more than just dental care. It's overall oral health because oftentimes the dentition may not be there, but we need to care for what's left, right, for these older adults. But even just care of the gum, cleaning of the oral cavity, particularly after meals, right, because food gets stuck in there, and then even having these areas examined, because again, the source of the pain could be something going on in there, and if no one's looking, we're not going to find out, right? Care of the lips. I think of it being, I don't even know what degree it is outside, but it's cold and there's snow everywhere right now where I'm at in Columbus, Ohio. And so lips being cracked and how uncomfortable that is, right? So just even moisture on the
My God,
lips,
maybe
on the
Vaseline.
skin. Yes, but I don't know if we're supposed to call the names of products on here, but
Oh, that's fine.
you did it. I did it.
Aquifer. I live with Aquifer.
Whatever it takes, whatever it takes. But again, so important for these individuals living with dementia who may not remember, right, to moisturize and put these things on there. But it could be pain provoking.
I know showering is often a challenge with folks who are under the care of a caregiver, especially those with dementia. I would imagine oral care can be very challenging as well.
It can be. It can be. But you do have experts. We do have experts out there who can offer tips and tricks on how to, you know, persuade individuals, so it sometimes can be likened to working with kids, right? Not exactly the same, but sometimes it takes a little bit of encouraging, to get in there. But it's extremely important because, really bad things can happen in the absence of improper or zero oral care.
Now, one of the challenges you face is overall improving the quality of life for family caregivers and their loved ones living with dementia. You mentioned that you've got some measures to confirm that that's actually happening through the Pair to Care program. What are those measures? What are you seeing?
Yeah. So these are some surveys that we use. They're developed for research, specifically quality of life scale, specifically for caregivers living with dementia. And this quality of life measure, the one that we use in particular, has these subscales, meaning these kind of categories. And I listed off a few of them that turned out to be significant, if you will, in our peer-to-care results where we looked at our family caregivers. So it just all depends, depending on whatever aspect of quality of life. In this case, for us, it's a family caregiver. And so we were lucky to have an instrument that is sensitive to that group of individuals. So it just all depends. Just like with our pain measures, the pain surveys that we use, ones that are specifically geared to or have been used in people living with dementia are the best ones that we should be selecting for studies such as the ones that I conduct with people living with dementia and their caregivers.
Are you still welcoming mentors and caregivers into the program?
So actually, at this very moment, we are not, because the study has been completed and we are awaiting additional funding to continue or to conduct our next study, which will be bigger than the last one we did. But at the same time, we are also exploring ways of taking peer-to-care out of the research space and being able to make it available to individuals in the community. And that is something that, I'm not able to speak too much on at the moment, but we're hoping that in the near future, we will be able to do that. So we are going to continue to do the work to make sure that peer-to-care is scientifically sound in the research and development space. But we also realize, particularly based on the results we've seen, the demand that we have for the program. It's been 2 years. This summer made 2 years since we were recruiting. This fall, we started in the fall 2 years ago. And this summer, we were still getting calls from people interested, trying to get into peer-to-care. So that tells us there's a need in the community. So we're exploring ways of being able to, while we're doing the work to refine it in the research and development space, get it out there into the community at the same time, right? So it doesn't take 17 years that research typically takes to get to the people that need it. We're not going to do that. We're not going to do that.
So I was going to ask, so what do you ascribe the success or the positive results to? Is it just simply talking to someone who's been there? Is it talking to them a certain, like once a week, once a month, or certain activities? I mean, what do you think brought the positive results?
I think there's so many reasons. I think the high burden of caregiving for someone living with dementia is astronomical, and individuals, these caregivers, being able to find companionship in somebody who has the lived experience, I think is probably the biggest part of the sauce. The biggest ingredient in the secret sauce is what I'll say. The fact that it's flexible, the fact that, they don't have to explain or be ashamed of some of the things that they would probably be ashamed to say to someone who is not familiar with dementia caregiving. I think the way that we pair individuals, I think, is unique and allows people to see a bit of themselves in the person that is connected to them. They can have the same hobbies. They can both be grandparents. So, I think there's a lot of good ingredients in the secret sauce.
Got to stop you right there. We are flat out of time. And Karen Moss, as always, it is wonderful talking with you, and we hope to continue following Pair to Care. For Tina Smith, I'm Ron Aaron. Thank you all for joining us on the award-winning Caregiver SOS On Air. The executive producer for Caregiver SOS On Air is Daniel Calderon. The producer is Sharice Pendleton. And the associate producer is Catherine Oglesby. We'll see you next week on Caregiver SOS On Air.
You've been listening to Caregiver SOS On Air, an exclusive presentation of the WellMed Charitable Foundation. We welcome emails with suggestions and comments on this program at radio@wellmed.net. Join co-hosts Carol Zernail and Ron Aaron next week for more on caregiving, improving the health and well-being of caregivers and their care recipients everywhere. For more on caregiving and podcasts of our programs, visit caregiversos.org.